Hello and welcome to Unstress. I am Dr Ron Ehrlich. Now, in a recent episode, I spoke to the author of the book Jaws, the story of a hidden epidemic, world-famous environmental biologist and ecologist, Professor Paul R. Ehrlich. My guest today is the co-author of that book, Dr. Sandra Kahn. Now, Sandra is a specialist orthodontist, as well as a physical anthropologist. The hidden epidemic is something that affects almost everyone to some degree in our modern world. That is, not enough room for all of the 32 teeth we have evolved to have over millions of years. Now, if we suddenly, in evolutionary terms, say over a period of a few thousand years or even 100 years, didn't have enough room for all 5 fingers on our hands, I'm sure we would not be as blasé about it. We'd be asking, what the hell's going on? No, I do not want my finger removed. But even the dental profession has come to accept narrow jaws and crowded teeth as a normal part of life without very much significance. Well, it is significant, as you will hear. In many recent episodes, we've explored the importance of breathing well through your nose, not your mouth. And we've discussed the importance of getting a consistently good night's sleep. That's a function of quantity, getting enough sleep, and quality, breathing well while you're asleep. So, not having enough room for your teeth means narrow jaws, and that means narrow upper airways. And that is the hidden epidemic going on right underneath our noses. I hope you enjoy this conversation I had with Dr. Sandra Kahn. Welcome to the show, Sandra.
Oh, thank you very much. Thank you for having us.
Sandra, well, I did speak to Paul, your co-author. You've written this wonderful book, Jaws, the story of a hidden epidemic. And I loved it. It's a beautifully written book, very accessible, and some great references and that. But and I want to talk about that. But I wanted to hear a little bit about yourself because you're an orthodontist.
Yes, I went to dental school, and then I got very interested in growth and development, or development of the cranium. So I was always interested in how we were developing. Then I became an orthodontist, not just to straighten teeth, but I just wanted to really understand how the face developed. And then after orthodontics or parallel, I did work in physical anthropology, which I found incredibly interesting. And one thing led to another, and I realized that, just like you read on the book, that the crooked teeth is really a consequence of the jaws not having developed to their genetic potential. And that's why the teeth don't fit.
Now, when you were studying orthodontics, because you went through dental school and then you did your specialty of the orthodontics, what was the standard, because the question is, why is it so? Why was it thought in dental school, in orthodontic specialties, that teeth are crooked?
Yeah, the whole health area is not it's not that focused on the reasons why things are happening. In medicine, it's a little bit easier to find cause and effect, but in dentistry, for some reason, they became separate from medicine. And Paul always laughs when he said, who decided that the mouth didn't belong in the rest of the body? Mm. And, I've done work and I've lived in Spain, in Europe. And in Europe, dentistry was a specialty of medicine. You have to study medicine first, and then you can specialize in stomatology. And in the U.S. and Mexico, where I trained originally, the specialty is more mechanical. We tend to be more, dealing with mechanics. So if you had a broken tooth, we just fix that tooth mechanically. And of course, we need to know how the body works, but we were more focused on, something that we consider external to the body, just like maybe a hair cutter that's, cutting your hair, or doing your nails. We were doing the teeth, and it's a specialty that goes in and out into the medical field. So we always looked at crooked teeth as a symptom that we could just do something about. And 100 years ago, that was the case because we were not having as much of an issue with the habits and the processed foods and all the issues that we talked about in the book. So 100 years ago, if you had crooked teeth and you fixed them, they pretty much stayed because we had good habits, good respiration. We were walking a lot, we were exercising our muscles everywhere. And so we had different rules of how to behave when we were eating, chewing more, chewing with the mouth closed. So as we changed the last 100 years, it just became, crooked teeth not only became more prevalent, but the habits that we've developed don't help to maintain them straight.
Yeah. Now, I heard you also mentioned that you spent time, or you are also a physical anthropologist, and considering that often all people find is a tooth, that seems like a perfect synergy, doesn't it, really, to have your dental training, your orthodontic training, and to be an anthropologist as well? What were some of the things that, that's a great combination. I've never really thought that.
Well, my original work that's published was done at the University of Berkeley, and I worked with an anthropologist, Gary Richards. And the original work that we did had to do with aging of immature skulls. So there was a sample of children that, anthropological sample. So it varied, but some of them were hundreds of years diseased, and they didn't know how old they were. So he invited me to work with him so that we could age the skulls, and we could say, this was a 7-year-old, this was a 10-year-old, this was, a 4-year-old, and that's all done through looking at the development of the teeth.
Yep.
So there's definitely an overlap, just like in many other areas.
Yeah. Now the book Jaws: The Story of a Hidden Epidemic. Tell a listener, for those that haven't read it yet, what that hidden silent epidemic is.
Well, the epidemic really is three things. It's crooked teeth. They're, you can see everywhere that more and more people are having to use braces. It's also the faces are falling back and down. You can see that, the prominent jaws are not as common. And by prominent, I mean, like, if you look at actors, famous people like Angelina Jolie or, very good-looking people tend to have this, the lower part of the face kind of sticking out more. And if you look around you, you'll see that a lot of people, their jaws look like they're almost melted back. And there's definitely, we've looked at a lot of research, and there's definitely it's more common that this is happening, and this is coming from us hanging our mouth open, and so the jaws are growing back and down. And the third thing that we're seeing as part of that epidemic are the sleep problems, and the sleep problems can be from snoring, which is really when the tongue kind of vibrates. You go to sleep at night and your tongue vibrates, you're snoring, and you have to open your mouth to get the air through your throat. And the progression of snoring ends up in what we call sleep apnea. And most people, lay people, are very familiar with this condition, because I don't think I've met anyone in any city today that doesn't have either a relative or a friend or somebody that they know that has to sleep with a mask to be able to breathe at night, because sleep apnea is when you stop your breathing at night.
Yeah, no. I mean, people just don't make that connection, do they, between the size of their mouth and the size of their airway? But it's profound.
Yeah, no, it's very profound, because the effects, what we've looked into the research and everything that's associated with, having a difficult sleep or difficult breathing is a lot of ailments that are so prevalent in our society, which is, it's scary. We have the I don't know if you want me to repeat things that Paul usually talks about.
No, go ahead. We talked about environmental issues and politics with Paul. I knew I was going to be talking to you, so I thought I'd leave the dental side to you.
Okay, because he's always, for me, the connection was made earlier in my career and through my patients and my children. But when he realizes that, okay, we're not sleeping well, our sleep is interrupted, and that is stress. And the stress is definitely associated with all kinds of things. And for me, with children, you think of all those ADHD and attention problems, but you're also looking at all the things that get you to have cancer and heart disease because you're having all that stress at night, and that affects also the amount of oxygen, which also affects the brain. So Alzheimer has been already correlated with these sleep issues. Alzheimer, memory problems, depression, even sexual dysfunction has to do with the stress that we have. Because if you imagine when you're sleeping, if you have a hard time breathing, that's the hours where you're supposed to be restful and relaxed are filled with all these stress hormones.
Yeah, well, it's music to my ears because it's something that this program is actually all about. And I want to go into that in a little more detail. I'm just intrigued about how you came together with Paul because his background is environmental and ecology, and yours is dental. And when I saw the book written by you both, and I just thought, wow, the timing of this is amazing. How did it come to be like that?
Well, that's very interesting, and I always like to say that that we really have to become broader in our views as scientists. And Paul is interested in the human predicament. Anything that's affecting humanity in a negative way, he's incredibly creative and incredibly interested. And we've become more siloed in our views, especially in science. And working with the evolutionary biologists was very instrumental for me. And we met socially. We became friends through our conservation work. But when I started telling him about all the stuff that I was uncovering, he just became appalled. And he really thought that we had to look deeper to see if my just observations were backed up by science. And if it was, then there was a lot that you could do. And he deals with issues every day in the environment that individual people cannot do much about. And this is the one thing that anybody, the individual, can change the situation for the children. So if you realize that this is a problem and you're having children and they're younger than 10 years old, you can actually change this environment for them and help them.
So Sandra, let me ask you,
Sure.
what do you think about Weston A. Price? I mean, he obviously explored this idea of jaw development. How do you think his research sits with what you're talking about?
Well, it's interesting because he is quite, unknown in the dental world. The dental world doesn't really acknowledge all his work, which is interesting because he was a very traditional dentist and he was the head of the American Dental Association for almost a decade. So at some point, we moved away from his observations. But when you start looking at causes, you go back and then you see that he did a lot of research and a lot of anecdotal evidence was gathered by him about the status not only of the jaw development, but the status of the whole dental and mouth situation in communities that were non-industrialized and lived and ate their traditional diets.
Yeah.
And he seemed to focus more on the component of the foods, or the type of foods, or the chemistry of the foods. And he noticed that all these communities that had more traditional foods, and usually they were hunter-gatherer type, so they had a lot of fruits and vegetables and a lot of animal protein and pretty unprocessed stuff. He talked about the communities that drank the milk without pasteurization, and there was a lot of just what we would call today farm to table, right? It's not, but he didn't really look at the consistency of the food, which is it's interesting because there's not a lot of research. Paul and I have been trying to find if there's anything that has been written on toughness of foods. And one of the things that we're looking at is trying to develop a chewiness chart or that we can...
An index of how much food needs to be chewed before it should be swallowed.
Yeah, yes.
Yep.
So we can recommend, or we can start doing some research and, have the same chewiness of food compared in different individuals.
Yep.
And there's not much around that. And that's just something that has plagued the whole health industry, because there's tons and tons of books and different diets, and everybody comes up with a different theory of how we can be healthier, but nobody's looking at how we're chewing and how much we're chewing and how challenging those foods are for the facial and chewing muscles.
Yeah, because I think Weston A. Price's hypothesis was that this was a nutrient-dense diet, and that was what allowed for the physical development of the person, not just the jaw, but of the person. But you and Paul have come up with the the idea that consistency was actually a factor that hasn't really been talked about.
Well, it's nice to think that Paul and I came up with it, but not really. This really was the brainchild of Dr. John Mew. He's the first one that I heard talking about. And there's other followers that have looked into this.
Yep.
But the thing to point out with Weston Price is that he, as a traditional dentist, head of the American Dental Association, very conservative, he looked at the three things that dentists are worried about: gum disease, caries or cavities, and also, malalignment or misalignment or crowding of the teeth. So those were the three things that he found that were completely absent on this traditional diet. Communities that ate this type of diet.
I think part of the problem with Weston A. Price was that he also did quite a lot of research on root canal therapies. And it led, because of his position and respected nature, it led to the removal of an awful lot of root canal or infected teeth. And then that somehow, I guess, from there emerged the science of endodontics, which is a whole other specialty. I think his work anthropologically, from a decay perspective, kind of fell away from the limelight there, as did the root canal one. I think that's where he went awry, where he seemed to lose his position, if you like.
Well, again, that's what happens. We've talked about our relationship with Paul and me, and having different practitioners working together from very, very different perspectives. And that's probably what happened, where he was just going through the very traditional dental awareness and very mechanical view of putting his theory into practice.
One of the things that I think I've said this to you is that what I'm so impressed by in this book, that after all of Paul's many years, shall we say over 60 years of interest in environment and ecology, comes up with, co-authors this book with you about the jaws, which I thought was just amazing, not only because we share the same names, but for the last 40 years, I've been sharing a similar interest, and to have him come up with that, and you of course, co-authoring it, was just remarkable. Remarkable that this is now finding the light of day.
Yeah, well, what can I say first about the name? I'm jealous because not only Paul and you, but also a Nobel laureate has the same name.
Yes, we have a hell of a cross to bear there. We've got big shoes to fill. But it was a great opportunity to talk to Paul, and a great opportunity to talk to you about it as well.
Yeah, no, but Paul is really, really one of the real thinkers of our time. I'm humbled when I talk to him and I realize how the view that he has about what he calls the human predicament. If we had 3 or 4 like him, humanity would be a lot better.
Absolutely, absolutely. Listen, thanks again. I just had to hear what you had to say about that, because it was a kind of I know you mentioned it in the book, and it was just so good to hear you put that into a perspective. I hope
it's fantastic that so many people now so many parents and families are now familiar with that, and they're incorporating these ideas that make total sense.
Yeah, and it is. I think the fact that Paul has recognised how important it is reaffirming what I think you and I obviously know, and that is that it is a very important part of the human condition.
Well, Jaws, the book is just getting incredible comments from thinkers that are not related to our sciences at all. Every day I get an email from Paul or from somebody else just telling me how fantastic the book is. And, they tell me they can't put it down.
Yeah. When did you start writing it? How long have you been working on the book for?
Well, I wrote a previous book, a very long 400-page book, and that took me about 10 years.
Right. And what was that called?
That's called Let's Face It.
Let's Face It.
And I was in the process of doing the translation. As you know, my first language is not English.
Uh-huh.
And it's written in Spanish, and I think it's a fantastic book. It's more of a consultation book for parents.
Right.
And that took me about 10 years to write. And Paul, we were talking, he looked at it, and, I was working on the translation, and he said, this is too long. You got to put this in a different format and no more than 100 pages, because this information has to get out to absolutely everyone.
Yeah.
And we decided to do the nonprofit work, and it took us about, I would say, between 2 to 3 years to get it done.
Yeah. So tell me, how prevalent, now going back to this silent epidemic, narrow jaws, how prevalent is it? How significant is it? I mean, you mentioned the narrow airway and that, but let's say how prevalent it is.
Well, we know that about 80% of children in industrialized society keep their mouth open at rest. And this is something that we've been looking at, what research is out there. And this is what the articles that are looking at normal children are publishing, or they're writing up. So 80%, that's the majority of the children in industrialized society, don't keep their mouth closed. And so we know that this is one of the initiators of the jaws not growing properly. Because in order to grow properly, you gotta have your muscles have to be strong enough to keep your mouth closed at rest. And so the genesis of this whole epidemic is really the children not having the environment that fosters the muscles. So if you are not breastfeeding, and if you're being fed by a bottle, then you're not working the muscles from birth. So those muscles are too weak to keep the mouth closed. And then we can add things like living indoors, which is, there's a lot of allergens, so that the nose gets stuffier. So you don't close your mouth, and you bypass the nose. The nose has important functions. The nose filters the air, warms it up, moisturizes the air, and it also adds antibacterial. So this starts a spiraling down into, not being able to close the mouth. And that's why the prevalence, we feel that it's 80%, because of the research we've gathered. If 80% of children are having their mouth open and they're having these issues, then they're not growing properly. And, there's a lot of information out there of how many people need braces, and it's also a very high percentage in population. So it's extremely prevalent. And the experts in sleep apnea, they also give incredible numbers, and there's some of them are quoting phrases saying that sleep apnea is going to be the most prevalent disease of industrialized society for the next couple of decades.
Yeah. And we kind of think of sleep apnea as stereotypically a middle-aged, overweight man, and beyond. But as you're pointing out, it's affecting children as well.
Yeah, this is my interest, because if things are not developing properly, we have to, and we want to focus on prevention or study prevention, how we keep from getting into these problems when we get older, then we have to look at how the children are growing. And this was my primary goal of writing Jaws, the book, was to really inform parents or anybody that has contact with very young children and change those habits early so that the growth is normal. And for normal, it just makes sense that normal means every part of our body has the space to develop. And we now have accepted as a society that wisdom teeth, the last molars in the arch, they're just going to be pulled out. And that's not normal. It's very common, but it's not normal. That's not the way our species is supposed to develop. We are supposed to have room for all our teeth, not the need to have anything pulled. So my goal with the book was to inform parents so that they can, foster the habits that will allow the children to develop properly, their jaws to grow big enough.
And what are those habits?
Well, we want to talk about number one, hanging the mouth open. And, there's a lot of habits that we're developing with industrialization, because industrialization really makes things easier, makes life easier. And biologically, anatomically, we are not designed for easy. And we know because everybody goes to the gym, right? Or anybody that wants to be healthy, they know that they want to go to the gym. And that's not easy. Mm-hmm. It's always hard to go in and lift those weights and, do those treadmills or whatever. We've known as a society that challenging ourselves is always healthy. So the same thing happens with the habits that involve the mouth and the teeth and chewing. We got to challenge ourselves, and children need to be challenged. Breastfeeding is a challenge. And, my own mother, who's in her 80s, she was telling me that she felt bad for her children when she was breastfeeding because she felt that they were suffering. She said they would work so hard, but, she's 80, so in her time, that's what everybody would do. And she said, you could see them sweat and working hard, so the muscles were working. Just like when you go to the gym, you're working. And that goes from birth, breastfeeding, to weaning. We got to wean our kids on challenging foods. We have to not be afraid of them choking, because anatomically, physiologically, we know that you cannot really choke when you're very young, because before you start speaking, we're able to swallow and breathe at the same time. So we can't give children harder foods as we wean them in the first year of life. And we need to give them things that challenge their tongue, their muscles, so they learn to work out all these things. And then the muscles will be strong to hold the jaw closed. If we have all these issues with those habits, and in addition to that, we live indoors, we go to daycares where there's a lot of disease, and we start getting the stuffy nose, then we're going to spiral into opening the mouth, hanging it, and the jaws are not going to grow to the size where they're going to be big enough to fit all the teeth.
Yeah, so challenging them with food that makes the jaw work hard.
Yeah, absolutely. Anything that challenges a child, the cells, the tissues, will help them develop better. I see, and I don't want to be critical of anybody, but I see that children sit at the table and they look at devices right now, and they just sit there and eat soft things. They take smoothies and hamburgers and macaroni and cheese and things that are almost pre-chewed. And they're just sitting there, and they're not sitting properly. They're not chewing with their mouth closed, or either talking or looking at their devices, and not really paying attention to eating with a certain posture or strength or attention. We usually teach young children how to chew, and we say, chew like you mean it. So concentrate on your chewing, chew hard. And the thing that cracks Paul up is that we recommend chewing gum, which it might feel like, one of those bad habits, but actually we need to teach children how to chew with their back teeth, because children now tend to nibble with the front teeth and then swallow the food almost whole because it's so processed. So all these habits, there's a series of things that make life easy. So taking a smoothie of all your vegetables and just sucking it through a straw will make your life easier. But if you actually take the kale and you chew it, 20 times, then you keep your teeth together and you swallow, you're actually challenging your muscles on your teeth, and you're actually squeezing the glands that put in certain enzymes into the food. So you start digestion starts in your mouth. If you take that smoothie, it bypasses the mouth, it goes directly to the stomach. And you're bypassing all those good things from mastication and from chewing with your back teeth. And so we need to go back and teach the kids. And it's harder because it is harder. It's more challenging, but it has really good effects. And doing the analogy to working out does help, because everybody knows working out, the more you challenge yourself, the healthier you are.
So, okay, now that's about development, but if the horse is already bolted, to coin a phrase, and the teeth are already crowded and someone's fronted up into your office, you've coined this word forwardontics. I wonder if you could share with our listener what that is and how that differs from the traditional approach to straightening teeth.
Well, forwardontics, yes, it's my own term, and it came from the work that Dr. John Muir did, and he called his technique orthotropics, which is very similar to orthodontics, but I incorporated all kinds of techniques, and forwardontics really focus on three things. We really want to help the jaws develop to fit the teeth, where orthodontics did the opposite. If you have crooked teeth, they say, oh, okay, we need to arrange the teeth to fit the jaw that you already have. And when you said if time has passed and you can't really change the size of the jaw because we're already grown, there's other techniques that we can use. I don't really work a lot with adults, but we change the jaws as much as we can. The younger we address the problem, the better effect we're going to have. So if we are already adults, we can stretch the jaw somewhat. Not as much as a child, but we can do that. So we can change the jaw, but we can always work on changing the habits. And even adults, we can change our breathing habits so that we're breathing more through our nose and less through our mouth. And then we also can focus on what we're doing at rest. So improving our posture of our body and of our mouth will also help. So the forwardontics really encompasses all the techniques that we use to change the habits and change the size of the jaw. So we pull the jaws forward with some appliances, we expand them, and we stay away from braces. We don't use braces.
Okay.
I do like to make a point that I'm not against orthodontics. I'm still an orthodontics at heart. I love my profession, and I think orthodontics really want to do the right thing. But we really haven't focused on things that really involve the cooperation of the patient, and that's the same in medicine. We want to have a magic people. We want the doctor to do it. And forwardontics is very heavy on patient compliance. Like, you guys need to do most of the work, and that's always hard.
Yeah, but it's very rewarding because I think one of the issues with orthodontics, and I know there was a study done at Washington University over many, many years, 40 years, I think, and they looked at all the orthodontic techniques and found that relapse, things relapsing to their old position, or not maybe as far back, but things not being as straight as they were when people finished their braces, occurred very commonly. I thought it was up around 90%. And I always felt, well, why is the relapse such a problem in orthodontics? Why do teeth move after they've been straightened?
Well, it's just what we've been talking about. If you don't change the base where the teeth are sitting, and you just change the teeth, then the teeth really don't have more room. They just, you pressure them into being in a certain position. And if you don't focus on the reason of why they were crooked in the first place. Let's say you had some habits where you were pulling your lips in. That is, a lot of people, a lot of my adults, I asked them to swallow, and you could see how they squeeze their lips really hard. So if you suck in your lips, you are going to be, putting a force on your teeth to be farther back inside your mouth, and that will give them less room. So we teach our adults to relax as they swallow. And that brings us into the GOPEX program, which is our exercise program.
Yes, I wanted to talk about that.
Yeah, that's learning a new way to chew, to swallow, and to breathe. And when I say breathe, it also includes how you speak. Because when we're speaking, if you observe people, most of us speak, when we're speaking, we breathe through our mouth. So we can change all these habits, and that helps with stability. Again, if we start with an adult, it's going to be much harder, but we can do exercises to improve the potential of our teeth staying where they need to be. Because as you said, the research shows that whatever we do, it's not permanent.
No, and tell us about the GOPEX exercise. So this is GOPEX. You're focusing on lips, tongue, cheeks.
Yeah, the magic of the GOPEX exercise is that we're not giving anybody any new exercises. We're just telling them that what they do already needs to be done with a different intention. It's really the intention. So let's say I want to teach you to breathe through your nose when you're speaking. Then, usually I work with children, but adults can do this program too. But what you do is you take 5 minutes a day and you read those 5 minutes with a certain intention. So you use the commas and the periods to make a pause, close your mouth, and inhale through your nose. And then you keep speaking. So, you learn a way, ideally, you repeat it enough times so that when you start speaking, you're always speaking, breathing through your nose. And that has a lot of health effects and benefits that we talked about the function of the nose. So the more we breathe through the nose, the better. And the same with the chewing. We talk a lot about, bringing back the family meal, sitting together and eating and slowing down our food instead of, eating in the car and just, taking a smoothie or a power bar and engulfing it really, really fast as we're running to do something. We want to slow people down at least one meal a day where you sit down and you focus. We tell the kids, chew like you mean it. So you have to focus and think of the intention of chewing. Chew on your back teeth, side to side with your lips closed, and choose harder, more consistent foods. We're not big fans of meat, but there's a lot of foods that you can cook in a way that they're actually more challenging. So the GOPEX is fantastic because it retrains your brain. And I'm fascinated by neurology, and now that we have working MRIs, we can see exactly how the brain can change. And the brain plasticity is incredible. Neurology is one of those fields that's changing almost every day because we realize that the brain actually can change itself. And we can, by repeating something enough times, we can change what we've been doing unconsciously. So the GOPEX has an element of retraining your brain to have healthier practices in your life.
And if we were trying to retrain our brain to do the right thing with our tongue, what would you say to your patient doing a GOPEX exercise for your tongue or the intention?
Well, we talk about the tropic premise, which is really having the tongue resting on the roof of the mouth, having the teeth in light contact, and breathing through the nose. So that's the rest posture. So when we sleep, we're supposed to have that tongue on the roof of our mouth. But it's very hard to tell our tongue what to do. And it's very interesting. If you tell the tongue something, the tongue will do the opposite.
Yes.
So
don't we know that as dentists?
Yes, yeah, definitely. If you're trying to work, and you tell a patient, keep your tongue away from this tooth because I'm going to work here. The first thing the tongue hears is like, tongue? Anybody said tongue? Did you call me? I'm right here.
Exactly.
And it just shows up. So you want to avoid even saying tongue when you're working. So basically you want to focus on the activity itself and the intention of the activity that you're doing. And we're at the end of the day, we have not evolved. I don't know if you talked to Paul about this, but this was the most important part of our collaboration is that he's an evolutionary biologist. So he's an authority telling me that the way our jaws are hanging right now and the sizes it's not a genetic problem because we haven't had enough evolutionary time to really have changed the size of our jaws. So we really have the same jaws of these hunter-gatherer skulls that I was studying that have, a centimeter of space behind the third molars, extra space. We have the potential to have that huge size of jaw. And if we have that size of jaw, we're not going to have snoring or sleep apnea or crowded teeth. We're not going to have any of the issues. So if we start taking some of those habits of the hunter-gatherers, and, we know now that if you walk 10 miles a day, it's very hard to get sick. And the same thing, if you chew with an intention and you're choosing on non-processed foods and chewing them properly, then you're going to be healthier. And it's something that we can all do, and the GOPEX helps you and guides you, and it has to be repetitive so that the brain starts doing it. The tongue actually, it's part of our digestive system, so it has a mind of its own. So we gotta just repeat the same things over and over to really make a change. But it can be done.
Yeah.
It can be done.
How early should you be seeing, what's your youngest patient that you've seen in your practice?
Well, that's a interesting question, because I like to talk to pregnant women. That's how early I like to see the patients, because we can start with those habits, even before the baby's born. And there have been studies about, sleep apnea, mothers that have sleep apnea and they're breathing through their mouth a lot, and how that affects the unborn baby. And my ideal time, really, being more practical, logistically, is once the children are being weaned. Then I can help to choose foods that are going to foster health. So between 18 months, 12, 18 months to 2 years to 4 years, that would be the ideal for me. If I could have a practice and teach parents how to teach their children, that would be ideal. But we know that parents have so many other things in their mind at those times. It's hard to think of pulling them to the orthodontist. So my most common age that I'm going to end up having is around 7-year-olds, 6, 7-year-olds, when the first permanent teeth come in. Then the parents look at those teeth and they go, oh my God. And I have friends that have, 5-year-olds, and they bring them to me and they pull the lip down and says, look, Sandra, look, the first tooth is coming in and it's actually, 90 degrees to where it should be. What's going on? And usually, traditionally, we say, well, wait till they're all in and then we'll do something. And if I can focus those 6, 7-year-olds in chewing well and breathing well and fostering all those GOPEX techniques, then they will not even have a problem, because that will be reversed.
Yeah. Now, well, how's the profession accepting this approach of forwardontics and GOPEX exercises? Are they embracing it with open arms? Are they excited about it?
Well, we tend to be very slow. If you read the book, we even have an example of Chewiness, teaching surgeons to wash their hands, and that wasn't received by the profession. We know that we're very slow at incorporating new ideas. So the profession is slowly realizing that what we're doing is not permanent, and we have to think of better ways. But it's not easy, and it hasn't been accepted yet. And that's why we focus on writing the book. You mentioned that it's very readable, it's short, and it's explaining to the lay person all our concepts. So we're bypassing the profession so that my goal is to have the parents demand better treatment. The parents can hold my book and go to their dentist and say, I don't want teeth to be pulled on my child. I want my child to be seen at 7 years old. And if they're told to wait, they should find somebody else and say, no, this is a time where I want to, make sure I focus on prevention and not correction.
Yeah. Look, it's a beautiful book and it's beautifully referenced. So if a parent was taking it along to a professional, the parent could not ask for a better referenced text. It's terrific. Listen, I wanted to ask you before we finish, I want to ask you one last question. Taking a step back from your role as an orthodontist practicing forwardontics, what do you think people's biggest challenge is today on their health journey in our modern world through life? What do you think that challenge is?
In relation to what I do, or in general?
No, just generally. Not that's what I'm saying. Taking a step back from your specialty, your observation as a person travelling through life, trying to be as healthy as you can, and having watched many other people do. What do you think the biggest challenge for us on our health journey is?
Well, in our health journey, I think the most difficult thing is being able to recognize what works and what doesn't. There's so much information out there. The internet is fantastic in one way, but it's very confusing in another. So finding exactly what is work and what is just, a snake oil, it's become very, very hard. And because the practitioners are so siloed. We talked about that. It's very hard for us to have an opinion on everything. And every day I have somebody come up with a question and I have no idea what they're talking about. And so figuring out what's good information and what's not is the biggest challenge. We gotta make sure that we as professionals, we look and we don't, we understand what's going on. And, common sense always helps, because what we are talking about makes a lot of sense to parents. And, when we have collaborations like in the evolutionary biologists and an orthodontist, we start seeing things that, make sense because we know how our species has evolved. So we need to have practitioners that, they jump to different areas and, just looking at all the information and deciding what's there and what's there just to make a profit and what's really there to help your health. But common sense is the most important thing that we can do to help our health. Just like we were talking about walking a lot and things that, have been done for hundreds or millions of years, and incorporate those practices. But that's a big challenge.
It is a big challenge. Sandra, thank you so much for joining us today. The book is fabulous. We're going to have links to it. I know all proceeds go to the non-for-profit organisations that both you and Paul are associated with. So thank you so much for joining us today.
Absolutely. Thank you very much for bringing this work to the public.
Interesting that in Europe you had to complete a medical degree and then do a subspecialty of dentistry. It's a recognition that the mouth is connected to the body. In the USA, UK and in Australia, the way dentists are trained has been, until recent times at least, very separate, very mechanical, fixing broken teeth, and it's been very easy to lose sight of how connected the mouth is to the body. And at the risk of stating the obvious, it always has been connected and it always will be. It literally is the gateway to good health. I thought it was also interesting to hear Sandra say, challenging ourselves is always healthy. That's why exercise is good for you. And that's why chewing more mindfully turns out to be a challenge worth pursuing for lots of reasons. Chew with intention, she said. Slow down, breathe through your nose, chew your food. Start the digestive process where it's meant to be started, in your mouth. Another thing is that new concepts in medicine, healthcare, dentistry, no matter how sensible or obvious they may be, are slow to be accepted by the profession as a whole and even slower by organisations that teach them. Sandra mentioned Semmelweis. You may have missed it, but Ignatius Semmelweis was a doctor in the late 19th century who had a very radical idea that at the time the profession totally rejected and in fact ridiculed for over 10 years. He became so frustrated that he ended his life in a mental institution. Semmelweis's very radical idea was, and wait for it, that medical staff should wash their hands and sterilise instruments between surgery when they move from one patient to the next. Now, can you imagine how they respond to even more radical ideas than that? A sobering thought. So I'll have the links to the book, of course, and her website, Sandra's website's on forwardontics, as she has coined the term, and it is a great book. I can recommend it. So until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this